Hello, everybody. This is Dr. Lori Langdon, board-certified pediatrician, mom of 6, grandmother to 2, here today with a new product that may be coming to market soon to explain it to you and what it's for. So you may have heard that the FDA approved a monoclonal antibody made by AstraZeneca and Sanofi called Beyfortus, Beyfortus, and it is to provide passive immunity. That is, it is a laboratory-produced monoclonal, meaning one type of antibody, just like your body can produce antibodies to fight off diseases. This one's already made and just gives the baby a straight antibody against RSV into their system. It would be an injection. It would be given once prior to the RSV season, which is typically late fall, winter. And the difference between this and what was already on the market, Synagis was its brand name, is that Synagis doesn't last very long in the system, so it has to be re-administered every month. And partially because of that, it's a very expensive product and it's almost cost prohibitive. So it's only administered to babies who are extremely high risk, like those with congenital heart disease or extreme prematurity. So the cool part about this new product potentially is that it's going to be marketed for all babies, especially young babies, those in their first year of life, during that first RSV season, and possibly again, depending on the situation, in their second year of life, if it's during the RSV season and there are any concerns. So this is a product that's specifically made for all infants because we know that RSV can be a problem even in those babies who don't have an extremely high risk for it. In fact, RSV is the #1 cause of hospital admissions in babies less than 1 year old. Potentially, this could be huge. This could cut down on so much heartache and illness and sickness and parents' fears and up all night watching your baby and wheezing and respiratory distress and the cost and agony and heartache of hospital admissions and IV fluids and prolonged wheezing afterwards. Because when you catch RSV, as an infant, it can increase your risk for then later going on to develop reactive airways disease or really just asthma. And so it would be great if we could prevent these babies from getting RSV in the first place and potentially, this is being very optimistic, cut down on the rates of asthma altogether through the years. That would be incredible. Now, there's a lot to still happen. You may remember from all the COVID vaccines and all the different steps they had to go through for different age groups. Well, similar to this, even though it is not a vaccine, remember, a vaccine is a tiny piece of the antigen or germ or foreign protein that then triggers your body to create antibodies. But that's active immunity. Your body's white blood cells are producing the antibodies. This new product is passive immunity. Antibodies are already made. Even though, and this is a little confusing, it could potentially appear on the childhood vaccine schedule because it is in the same spirit of vaccines to prevent severe disease. It's an injection and you give it at a certain time. So that does have a lot of similarities to a vaccine, obviously. So in keeping with that, the Advisory Committee on Immunization Practices, ACIP, that advises the CDC is going to meet in early August to discuss this product and most likely will also approve it. And then we have to see, wait, how expensive is this? Remember, I told you Synagis, the other monoclonal antibody already on the market, is extremely expensive. So hopefully this won't be, but we don't know yet. And we don't know how insurances are going to cover it. So there are a lot of questions about this product, but I'm still encouraged because potentially it can make a huge difference. Even imagine, if you will, how swamped we are in the peds office in the fall and winter with upper respiratory infections. If we could cut out, and RSV plays a huge role in that and is a large percentage of those upper respiratory infections. And then with RSV, of course, lower respiratory tract infections as well. But if we could cut that out, that could make a huge difference. In fact, I had a recent television interview about this, and I was trying to make a funny joke and use a pun and said it could even help with congestion in the peds offices, haha. But my person interviewing me did not get my hilarious joke. So I just want you to think of this product as potentially life-changing, altering all kind of things that we've dealt with for years as far as like the spike in hospital admissions during RSV season and things like that. This could have a huge, huge, huge impact on those things. So I'm excited about it. But again, a lot remains to be decided. So we shall see. Time will tell, and I will try to keep you updated as this comes to market potentially. So stay tuned. Thanks.